Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Abnormal sexual development. In females, normally clitoris and labia majora are seen. In males, normally penis, testis is palpable in the scrotum. In abnormal sexual development, females may present with clitoromegaly or labial fusion, whereas males may present with small penis, that is phallus, or they may present with non-palpable testis and hypospadias. First investigation to perform when suspecting abnormal sexual development is karyotyping. Best clinical method to ascertain the sex of a female is absence of palpable gonads. Time of birth. At the time of birth, the most common method of sex determination is by examination of external genitalia.
Most common method of sex development at the time of birth is by examining external genitalia.
thank you and thank you for watching.